I think I probably know most people on the call. My name's Claire Bushner and I'm one of the senior team within HSCNI. And you're very welcome to this episode of Digital Dispatches. And today we have pleasure of being joined by our colleagues from Big Motive, who we have worked with on a variety of projects over the last number of years. And they're not just colleagues, but they're friends too now. And we thought it was opportune to have a session on service design, because as we move forward on our digital journey and we now have our new strategy, it's essential that service design is integral to how we are designing and developing our services going forward. And what the guys are going to talk to us about today is really about applying those practical and very creative design methodologies to how we think about how we design and use digital as part of our service delivery. Not only, and the whole aspect of what we do has to make and meet the need, make the experience and meet the needs of our users and our services and our system as a whole. So I don't know who's going to start the talking, but we've got three colleagues from Big Motive who will share their screen. We have Hannah, Rebecca and Marnie, all from Big Motive. So I'm going to pass over to who's leading. Rebecca's starting.
I'll start.
So I'll put my microphone on mute and pass over to Rebecca. As for those of you who haven't been on Digital Dispatches before, this is a very informal lunchtime session. So if you have questions, please just put them into the chat and we can pick those up as we go along and then have some discussion at the end. Okay, right, perfect. Over to you, Rebecca.
Great, thank you, Claire. I'm delighted to be here today on Digital Dispatches, and thank you very much for the intro, Claire, and the invitation to come and join you for this lunch and learn. So as Claire said, we're going to be talking about service design, and I'm absolutely delighted to have my colleagues here, my service designers here with me today, just to talk a bit about how we use the service design methodology and some projects we've worked on in health and social care, some challenges we've come up against, but also some of the benefits of using service design as well. So we'll try to keep it to about 40 minutes and then we'd be absolutely delighted to take some questions afterwards. So my name is Rebecca Walsh and I am Design Director at Big Motive. And I really focus on service design and research within Big Motive. And I work mainly in healthcare and I would work mainly in the public sector. And I will hand over to Maíra, who'll do a quick introduction as well.
Thank you, Rebecca. I'm Maíra. I am the service design lead at Big Motive. I have a background in sustainability, education, and obviously design. I facilitate processes at Big Motive. I'm also involved in the health side of things, but also in some of the innovation processes. I'll pass it to Hannah.
Hello, lovely to meet you all. My name is Hannah and I'm a senior designer at Big Motive. I have a background in product design of medical devices, so healthcare has always been a big passion of mine, and a PhD in biomechanical engineering. So I'm very happy to be here today to share a bit about good service design and hope you enjoy the presentation.
Brilliant, thank you. So for those who don't know Big Motive, we are an experienced design organisation, and as you've probably gathered, we have a diverse team from a range of backgrounds. So Hannah and I are both engineering background, and Maíra, as she said, sustainability and behavioural design as well. But we have product designers and we have also people who have come from academia and research, and we have software developers, and we have graphic and content designers as well. So we really feel like that mix of skills is extremely important, especially when we're looking at big complex challenges in terms of healthcare. And Hannah and I have said this before, coming from an engineering, mechanical, aeronautical background, we feel like the health space is probably as complex as working in engineering. And it's really, really good for trying to work out how we try to solve problems in a really complex type of environment as well, and really thinking about systems as well as services. So the four main aspects of Big Motive, the things that we work on, are generally product design and UX. So that will be getting into digital design and really thinking about how products look and function. And we work on service design, and that again is looking holistically at your service from an end-to-end user point of view. I'll go into a bit more detail about what service design is later on in the slides. We also look at education and learning in the business as well. And we really think about how we can empower the teams that we work with to really embed the design process within their own organization. So that's a big thing for us. And we notice that more with our clients, that they don't always just want somebody to come in and tell them how to do these things. They really want to work with our team and different types of design teams to really think about how they can get their organization start thinking about this for all different types of challenges that they face as well. And the last thing we look at is innovation and strategy. So really how to think about digital transformation at scale and really think about your design strategy within your organization as well. And these are some of our health and social care clients. So I'd say about 50 to 60% of the business is private or public sector, 40% private sector, and actually within that, health would be probably our biggest client. So here are some people that we work with. We worked with HSCNI, as Claire said, we're good friends now. We've been through a lot in COVID times, and I actually sat on the Innovation Community of Practice for Health and Social Care when I was in public sector as well with Claire. And worked with Linda as well on a few projects as well when I was in the Innovation Lab in the Department of Finance. But we've worked mainly on the COVID response over the last couple of years, and we'll share some of those case studies as well as we go along. We've also worked with NHS Scotland. We work with the voluntary and community sector, so Age Northern Ireland. We work with a couple of private sector organisations in health. AFLO is a really lovely project, and it's about a companion app for a spacer or a device that sits between your spacer and your inhaler that really improves your technique of using your inhaler for people with asthma and COPD. And we work with the Leadership Centre on training and learning, Public Health Agency, and the universities as well. So that's just some of our kind of health clients and the projects we'll be working on in health. So I'm going to hand over to Hannah, and she's going to take you through a couple of hopefully collaborative tasks here.
Yes, so we're going to put you to work immediately. Okay, so we would love to have you tell us about a positive experience that you've recently had, a positive service experience, really to find out what a good service means to you. So now I think Maíra or Rebecca is going to pop a link into the chat, and it should bring you to the magical world of Slido, where we can add your answers on the website, and they'll come up here anonymously. So please do add in, what is a positive service experience that you've had recently? It'd be great to see.
Doesn't have to be healthcare, could be anything, any sort of service you've experienced over the last couple of weeks, couple of months, couple of days.
Great. GPs, passport renewal. I think the passport one's really good, actually. It's become a lot more smarter now, and you can do it on your phone. Brilliant. Some good words there about painless services, home insurance, EasyJet app. Oh, haven't tried that yet. Tesco handheld devices. I love that. It's terrible now having to forgetting to pick one up and then having to queue up with everybody else. Brilliant. Okay, I think that's everyone. Stop typing. So quite a wide range of different services there, and really good to know that we've kind of all had experience with good services and know what they are and how we recognize them. So I'm going to put another question to you now, and that is, with the community in mind, what is your vision for your own service or services that you're working on? So we'd love to get your thoughts on this. So again, the same way, what is the vision? What's your future outlook for this? And now we're using the term community here as sort of an umbrella term for all your different users. So patients, service users, healthcare professionals, whoever your users are. With them in mind, what does the future of your services look like? That's great. We've got seamless, collaboration, agile, modern, easy to contact, and compassionate. That's a good one. Responsive, empowering people, built around needs and family needs. These are all good things and good service design, and definitely things that we should be aiming towards. Okay, I think that's everybody's answers in. So thank you so much for sharing those. It is really great to see, and it's really somewhere that we hope to be, and hopefully in the future we can see these things realized. But it's great to start thinking about good services and what does that mean? Because unlike a physical product, they're often something that we can't see, and it can be difficult to frame or see the edges of. So I'd like to show you next this quote, and this is from Lou Down, who essentially founded the idea of service design in government, and has done a lot of great work in UK government, such as gov.uk. But 80%, about 80% of the cost of UK government is spent on services. And if you think about it, it is the oldest and largest service provider in the UK. But maybe we often think about government outputs as processes or procedures or guidance, but these are all parts of services. And as Lou highlights, it's what the government mostly consists of. But because services are so intangible, we can often see them as smaller, disconnected pieces of processes or procedures that are often worked on in silos to tight deadlines in response to policy changes, process updates, or digital transformations, and many times without much design. So that brings me to my next figure from Lou. And that is that 60% of the cost of these services is spent on service failures. So that's quite a big number. These can be like phone calls whenever users get stuck, casework when forms aren't filled in correctly. It's time, cost, and resource for making up or trying to cope with these failures in services. And because of my product design background, I always try and think of it like, with a product, before we send it out the door, before we sell it to users or provide it to the public, we would always try and make sure it's good and it works before we put it out the door. But with services, that's a lot harder to do because they're intangible. So they can be out there, they can be put out there and not working for years, and that can be very costly. So how can we work better to create good services and avoid the cost of these failures? And I guess that's where service design comes in. So I'll hand over to Rebecca to introduce service design.
Yeah, so I'm sure some people here have heard of service design, have worked on service design projects. And I suppose a lot of people do still ask us, like, what is service design? So saying the government is made up of 80%, or 80% of government is services, and really we're spending, it's the actual biggest cost to UK taxpayers is failure in services. So this is why we start thinking about service design. And really, a service is just something that helps a user, a citizen, a person do something. And Hannah mentioned there about, we talk about the community now when we're designing. I was at the first ever Design and Government conference in Dublin on Friday, and it was brilliant. And one of the highlights for me was somebody saying that actually within our service, people talk about users and citizens, but actually we are designing for the community, and the community includes us as service providers. It includes your frontline staff. It includes anyone using the service. And really what we're trying to do is design something for those individuals, for the community. And really design is just the process of solving problems and creating innovative solutions. But what we really do in the business is think about how we do that based on user needs. So that user could be your patient. It could be, the person ringing the GP for advice. It could be the person, the ward manager, who's looking at systems within the ward and how to use those. It's anything that somebody is interacting with in terms of what you're providing within your system. So service design is really about thinking about a way to really seamlessly produce those services for your users. And the one thing that we come up time and time against is that people don't think about the frontline staff, the users within the healthcare system, as those people who need services designed for those. So that's something that we really need to keep in mind with service design. So really, what are we talking about when we talk about services? Well, I suppose we're doing this for digital health and care in Northern Ireland. So we think about services from like a digital solution point of view. But that's not the only thing that service designers will look at in terms of the design process. So your design could think about the overall system. It could think about a toolkit. You could be thinking about a process within it and designing that out, or a product. It could be a face-to-face service. It could be a physical service. It could be all of the above. It could be a telephony service. So somebody said there they had a great experience with their GP service. That is something that is around telephony services at the minute, as well as online services. So we really need to think about all of those different types of services when we think about service design, and not that service design should only be used for new digital services or improving digital services that we have already created at some point. So examples of digital services, you've given loads of examples in the question that Hannah posed there about things that you've used, like the EasyJet app, or maybe an online booking for something. And this is one of our case studies, which we worked with Linda on here, which was the digital solution for contact tracing. And that was the Stop COVID Northern Ireland app. So this is a great example of a completely new piece of technology, and thinking about trying to design for every single user or citizen or member of the community in Northern Ireland. So this wasn't just for a particular age group or a particular demographic. This was for absolutely everyone. So user needs was extremely important to this project. But we also have been involved in looking at, more sort of paper-based services, maybe online services that isn't an app or a website. So we did a piece of work with the Strategic Investment Board pre-COVID to look at a toolkit for people living with learning disabilities. And here are just some images of workshops that we did when we were able to do face-to-face workshops, which was just brilliant. And we're starting to do that again, which is great. And this wasn't about digital at all. This was just about trying to understand how we could improve the communication between the trusts and people with learning disabilities to basically provide better services to those people, really understanding what their needs are as well. So service design challenges. So we're talking about this in terms, and I know I wrote this in the summary of the presentation, but we are, as you could probably tell, very passionate about service design. We've really seen how it's had a massive impact on projects within the health service, but also for the users as well. But it doesn't come without its challenges. And funny, Sue Hun in the PHS sent me a link there through Twitter this morning about limitations of design in health. And some of them are about these elements as well. And there's some different things in there as well. But some things that we've noticed in the work that we're doing in HSC, in the NHS, in HSE, it's all about how accepting the area is to change, because this is a different process, and there have been a lot of processes that have been tried and a lot of processes that are still ongoing, you know, Lean, Six Sigma, Agile, design, you know, QI, all of those different things. So people are starting to look at change, but it's also, we're working with a very risk averse type of system. So we really need to think about how we try to look at those challenges and try to improve that as well. Also, and you know, Hannah and I have talked about this coming from an engineering background, you know, sometimes failure isn't an option, that it's very, very hard to prototype small things because it feels, again, risky that you're doing something small. And what if that has adverse outcomes for the patient? You know, what can we do to make sure that things are prototyped in a small scale, but also being aware that we really don't want things to fail. But the risk is that we implement something too quickly and something too big, and that failure is far bigger than what it would be if we prototype something small. What we've noticed as well is that when we go into a certain team or a certain trust, we find that the services are quite siloed. So sometimes when we think about a service design approach where we're looking at an end-to-end patient journey, we might actually be looking at 5 or 6 different interactions with different parts of the system. And sometimes we can't actually, we're not able to talk to those people. We can't access those teams to be able to see how the service actually works within those areas. I think this is the biggest one for me. And I just did a presentation recently in Dublin around years of technology first implementation and that risk. We tend to go technology first, and it tends to be how things are procured as well internally. You know, we need a system, so we're going to put the system in place. But what we try to say from a design point of view is really try to understand your challenge, your problem first, really try to go out there and get the right solution. And that is a change in mindset for a lot of people as well, but something that we really need to think about. So how do we get the user needs to be able to think about what sort of technology we need to implement within that service and measure it correctly as well when we do that. We've noticed that, as it's amazing to see people here, but some people just aren't familiar with the design process. So when we start a process like this, some people are not sure what exactly we're going to come in to do, and a bit nervous about us going out to users sometimes as well, users that maybe wouldn't typically be in your PPI groups, you know, people who are just out in the community, and what we'll bring back in terms of feedback as well. And the biggest challenge, one of the biggest challenges is time. Everyone's under pressure. This feels like a new process. It's different. It's embedded in some organizations, it's not in others, and it requires time and resource. But we always feel like if you do embed it, then you're actually reducing the amount of resource required on certain things because you're getting it right again first time. So with that, then I think we're going to start looking at how service design can really help. And what we find is that it really does try to fill in those blanks, so those gaps within your service. It's really trying to understand and solve the problems, really trying to define those problems to make sure that you are doing your research in the right areas, that you're implementing your new technology, your new telephony service in the right place, you know, with the right process. And it's about trying to design with, you know, with people. The whole process is bringing them on the journey with you. And then the last one is really about fostering collaboration as well across teams and trying to break down those silos too. So we're going to go into each one of those quite quickly because we're limited in time, and just a very small case study against each one as well.
Yeah, so the first one there is to fill in the blanks. So the very start of service design, we look to fill in the blanks. What do we know? What do we not know? Let's ask the right questions. Let's expand on this known zone to understand the service context, requirements, and efficiencies. And this is really what's going to help us to design a suitable solution and a good service. We often start a project with assumptions, but we have the responsibility to investigate these and make sure that they reflect what's actually been done in practice. And this also applies to policy or procedure. So just because there's a policy that says it needs to be done X, Y, Z, it's not necessarily always the way it's practiced. And that could be because someone's found a more efficient way to do it or interpreted the policy differently. So an example of this one is where we've worked with developing a hospital visitor booking system. Now this project was commissioned during the pandemic to support safe visiting during the restrictions. And the temptation here might be to really take the hospital visiting policy at that time and create a system based off the formula rules in that policy. However, whenever we undertook the filling in the blanks and the research, we spoke to all the different people that were linked to the service, trust admin teams, IT, ward staff, call handlers, and we discovered that this was a complex problem which would encompass a lot of different actual practices. So by filling in these gaps, we were able to better understand the service and the requirements and what problems we need to solve, and how we're going to actually design this to meet both policy and also practice.
Now I'm going to tell you a little bit about this second point of learning and where service design can be helpful, which is to understand and solve problems. So once you have done this initial phase of understanding where the blanks are and you grow your knowledge, you will have awareness of where you're at and you can start to tackle the different problems you have discovered. And it's really important to remember that every service has a life cycle, right? And depending on where you're at with the service, your challenges are going to be different, and therefore the solutions are going to be different. And it's all about finding where you're at and what's the process to go through. So if you're at an early stage, you probably want to do a bit of a discovery, understand where you're at and what's the context. If you're going to implement, it's important to maybe test first and see how people are feeling about it. Once you have implemented, there might be a step there with quality improvement or having to adapt your service because there's a new policy in place or something that has come up that hasn't been foreseen when the service was first designed. And then something that is quite interesting we're learning more about is the notion that maybe it's also important to keep in mind that your service might end at some stage. So as an example, one of the solutions that we designed for the COVID response was the first app, which was called COVID Care. It was an information tool that just gave the citizens a bit of information on self-isolation times or a little triage to understand how they're feeling, information about symptoms and so on. And that app has just been decommissioned because it served this purpose and now it can go and live in the digital sphere of heaven. But it did have a life cycle and we went through all of these stages with it. And this whole project, actually, some of you were in the room when we were designing it, right? We had a bunch of journey maps that were actually pasted on the walls, and we were looking at all of the different solutions and how they work together. So it's all about learning together, sharing together, and improving together. The second or the third actual principle here is to design with and not for people. So Rebecca mentioned it's about bringing people with you. It's not designing for somebody based on assumptions. It's really having them in the room. And by people, I mean not only the service users, but also clinicians, professionals, support staff, service users, everybody participating in a collaborative process and really always taking into account the edges of the community, who are the people who might not even be able to be physically present in the room or have their voice heard through, the normal ways. How can we make sure that the services are accessible to them as well? So we take that really, really seriously. The example that I'd like to give here is Patterns, which is an R&D initiative that's been led by us in partnership with HSC, the Regional Pain Forum, and both Queen's and Ulster universities. Patterns is a mobile app, which has been designed to support people living with chronic pain. And that's come up because the list for people with chronic pain here are actually quite long, and we want to be able to offer them a space for an alternative pain management experience, which is about setting and tracking goals. We have just launched the third phase of the SBRI, and I'm showing you this because this app was really designed with the people who have some form of chronic pain, but also carers and medical doctors who understand how setting goals can actually empower users to recognize their pain process and understand them and help them understand how to cope better with their condition while giving clinicians essential data on their condition.
Yeah, and the final one then is really about this collaboration. So this is why we're actually delighted that we're starting to work with people face-to-face again, and we're getting workshops organized and we're getting people around the table again, not just on Zoom, but also in a physical space where we can really walk through these challenges. And the big thing is that we would say that we're not the expert in all of these. We're not the consultants that will come in and tell you what to do, but we will work with all the teams to get the best solution to the challenge. So it really is about bringing in those multi-stakeholder groups, including the users and the providers and anyone else that we need, the IT teams, the policy designers, software developers, the trust, whoever we need into the room, and really thinking about it from a service level point of view, and not just from maybe one of the a digital product or a piece of a system that we're trying to design. So it's really, really important, because we are not able to understand that end-to-end user journey for people unless we do that. And funny, we were just talking about this yesterday. We're working on an Innovate UK project at the minute with the Southern Trust and HSCNI and Ulster University, and it's all about fall prevention. So it's a team called Move More, Live More, a product called Move More, Live More, and it's really about trying to get people to use digital technologies to predict falls. And it was really interesting because there are multiple people in this group. It's a big consortium, and the user could be working with Age Northern Ireland, but they could be using a product by a company called Technicare, but they could be getting a phone call from an organization from Taking Care, and they might be told that it's a service that's applicable to them from the Southern Trust. And we were trying to say that for that user, they don't really care or know that these are multiple different services. They are thinking that they're going through one service. So having touch points with multiple different organizations to the user is extremely confusing. So if we're doing this, we need to make sure that that feels really seamless, that they feel like they're using a device, but they're working with a team to get information, and it's all in the same program, but the app they log into is branded the same. So they feel like the information they're getting from HSCNI and the app is the same. So it's been a really lovely piece of work. And actually, for anyone here who works in Innovate UK projects, I'm not sure if you do, this was one of the first Innovate UK where they have a design gate in the project. It is the first time that they actually take a pause at 6 months and say that you have to prove that you have practiced human-centered design within your project, or you will not get the funding for the next 18 months. So anyone who is looking at Innovate UK projects within your own area or trust, just be aware that they're really starting to push that. And this is where, having expertise in the process really, really has helped the consortium through that design gate process as well. And again, this is a pilot, but people have been flagged at high risks, and people have been prevented from having a fall because of that intervention as well. So a really beautiful project that we've been involved in from a research and service design point of view. So that is us. We just wanted to give you a whistle-stop tour of service design, but we also wanted to see some of the projects that we've worked on in practice. So it gives you a sense of how many different types of projects you can apply this to in different environments and different types of users, but all within that health context. So what we would like maybe from the questions, from the conversation afterwards, is just to have a think about, can you see a future for service design in your organization? And what does that look like? What are the next steps for you? Because as we work with the healthcare system, we continue to see more and more services that we would love to improve. I think most of our group chat internally is us sharing resources and websites that aren't accessible or inclusive, and just asking like, who do we need to speak to fix this, or can we give somebody a bit of advice on this? It seems to be a consistent thread through all of our communication internally. And there might have been one piece of that process that you think, oh yeah, I'm doing that, but it's, you know, it's another methodology that I use. We're super interested in that as well. But it'd be nice just to hear a bit of your thoughts on how you think service design could help.
Thank you. Thank you.
Oh, and here's our details. We're a corporate member, a corporate partner for the Design Council. We're also a member of the Service Design Network, and we do normally post things on socials. So if you want to follow us, feel free.
Yeah. Oh, you're very good. You're very good at posting on the old socials.
We are good at posting. It's normally dogs. It's normally dogs and
it is.
Workshops, but
So
like we're into dogs.
You posed a question in your previous slide there, Rebecca, and in true MC style, of course, anticipating that everybody would stay with their cameras off, and it was like looking into Hello Darkness, my old friend. That you would have thought that we had maybe rehearsed, so I had something very similar. So I had as part of discussion, do we believe it's easy to take a service design approach? How familiar do you feel you or your staff or organisation is with service design? And what do you think we need to do to move away from a technology first implementation approach that we would probably take now? So I think that those my thoughts about are really what you have posed there. So I want to open it up to all the little dark squares on the screen now, to have a bit of discussion. So really thinking, you know, has anybody had any experience of using service design methodology, good, bad, and different? How familiar do you think we are with service design in health? And if we don't think we are familiar with, what do you think we should do as a system to improve that? So if you're coming off mic to ask a question or contribute to the discussion, just let us know who you are and where you hail from. Not as in part of the country, probably what organisation you come from. You can tell us what part of the country you hail from as well. That's okay. So I'll open it up.
I can pick on somebody because I know one or two people here who do.
Okay.
Who have used service design, but I'll let you.
You have been warned.
Claire, this is Damien Moore. I'm slightly puzzled by your question. I was wondering, was it a question for each and every one of us, or a question?
No, just a general. You know, has anybody in the audience been involved in service design? And if not, do you think it is something that, you know, we should be doing? And if it is, how might we go about that? What might the next steps be? How do we familiarise our staff with this type of methodology?
I was going to say Stephen can say something about it. I was actually going to pick on Stephen.
Stephen, do you want to come off mic and elaborate on that?
Sorry, I can't speak properly. I'm post-COVID. I'm kind of.
Oh, sorry.
No, you're fine.
You okay?
No, there is. I don't know. I think I've said this before, and I think it's brilliant that we're talking about this, because we need to do more of this, showing people what design thinking or great work that Rebecca and others can do. But there is a community of service designers in the NHS, so maybe we need to look what their experiences have been. So, you know, perhaps a community of practice, or perhaps feeding in. I know there's a Future NHS platform now that I use in my work.
Yeah.
So that's kind of linking with colleagues over in the other regions, and that's been very helpful.
Thanks, Stephen. Yeah, I look at Future NHS too.
So this is so the conference I was at in Dublin on Friday. So this was starting to think about those GDS NHS principles for design as well, and starting to think about how they do that for Irish government. So they actually prototyped a number of principles. They're actually all on these cards, and they've sent it away with senior civil servants, and they have a lovely wee sort of example of how you would use the principle behind it. And they've sent them away as prototypes to go, how would you use these in practice? Like, put them up on the wall in your team area. Now, they're not far away from the GDS design principles or the NHS design principles. You know, put people first will be, you know, inclusive, will design services together. But it was a really big thing for them to be launched at that conference, because funny enough, I tweeted Jane Brady afterwards and said, we need these for Northern Ireland. Like, how do we do this? So yeah, Stephen, totally agree. There's some really great stuff out there just in terms of principles that you could apply. And maybe we think about what our own principles are and whether they differ in our context as well. You know, maybe one or two of them are slightly different, but happy to share this report if anyone wants it. It's a really, really lovely piece of work that was with Creative Ireland, the Department for Public Expenditure and Reform, and the IDI, so the Institute of Designers Ireland, with SDN. So I'm happy to share if anyone, or I'll send it to you, Claire, and you can share it to the group, whichever.
Great, thank you.
Claire,
Stephen.
From my just before I go and eat my sandwich, and I think this is something where really what I was taking was the notion to rush to technology, and I think we do that all the time in health and social care. And I look to exemplars like the Northern Trust, who I mind do very good process mapping, and they really do that well. And maybe the opportunity for us is to do more of this, as opposed to just rushing to buy a system and then put it in, and then we generally tidy up the mess that we've created thereafter. So it's more about the people, the process, and the technology, I think, is the summary that I'm trying to get to.
Yeah, I would agree, Stephen. And we're definitely getting better. But you'll remember back in the good old days, and clinicians still say to me, oh, but sure, it's all technology driven. You know, they come out with these gadgets and these widgets, and they say, there you are, nurse so and so, that'll help you do your job. And nurse so and so looks at it and says, well, A, I didn't ask for it, and B, nobody asked me whether it would help me do my job, and they throw it in a drawer. So I think we've moved a wee bit beyond that, but I don't think I could sit here hand on heart and say we've totally adopted a service design approach across the board. We've got some examples of really good practice, you know, that the guys have shown us some examples, and that's just the tip of the iceberg of some of the work that I've personally been involved in over the last couple of years. But we all know you can't build it and they will come anymore. That's not the mindset of any customer in any business anymore. It has to, you know, we all identified, you know, good things, and we've all been on websites and we've all used apps that, you know, you download thinking it's going to be the greatest thing, and then you go on and you use it a couple of times and it's absolutely woeful. You know, well, that was obviously hadn't been designed in a way where it was user friendly and hadn't gone through any user test, and we've all had experiences like that. And I suppose we are in the business where you can't really have people turning away from your services, because people who don't engage or turn away from your services, there could be quite serious consequences if people got a bit annoyed that your service wasn't delivering what they expected the service to deliver. So we need to definitely get better at that. Maybe J-Pip.
Hi everybody.
Hi,
my
Neil.
name Neil Casta. I'm the telecoms manager within the Western Trust.
Hi, Neil.
How's it going? I was just listening to the whole presentation there, and I suppose we've sort of developed a few apps internally ourselves, and probably could see benefit from service design. You know, we probably have, in our own way, used some of the principles, but maybe not to the full effect. We currently have a Connect West app, which has been put out. It's just deployed. It's available at the minute for sort of to change the way the patients communicate with our contact centers for partial booking. Primarily, it started out for breast screening, so we've just deployed it for it, but we're now currently moving the next stages for partial booking, basically, so the patients can use a chat app to rearrange their appointment.
I was hearing all about it last week.
Were you? Right, okay. Where was that from, or was it?
We were talking about we were on the Encompass design group for the patient portal, and we were talking about giving people the choice, giving people choice of new ways of communicating with health and social care, and the Western Trust representative was telling us about the chat app. Yeah.
Okay.
Neil, would you be prepared to come and do digital dispatches about the work that you've done on that?
Yeah, we would, yeah.
I'll speak to you about a slot in February.
Okay, no problem.
See, you need to be careful when you come to these things.
I know, sometimes it's better to stay quiet.
Well, it's all about sharing our learning. So.
No, well, that's it. Well, so far it's bearing fruit. I mean, partial booking is probably a much bigger audience than what breast screening would be. Yeah. But we just wanted to get all the bits and pieces sorted out before we move to a bigger audience. But hopefully we'll see how it goes.
So it's sort of middle of test at the minute then, Neil, is it?
Well, we've been working on it for nearly a year, back and forward. So breast screening, it fully developed. So basically it locates where the buses, the breast screening buses. So it's sort of, we've embedded more than just the chat app. So it's sort of the chat app about changing an appointment's one thing. And then what we've done is embedded, about location services for where the buses are going to be, at what GP practice they're going to be, what dates are going to be there. And sort of we've done a link into information basically about breast screening, and just used that basically for that service, to wrap everything around that service. Yeah. And then the plan is to move to partial booking, and then sort of, the likes of endoscopy and all of those, and then wrap around information around those services as well. So it's sort of, typically what we've done is sort of asked the questions of the services. What questions are you asked whenever people's booking their appointments, and whenever they arrive, what sort of questions are they asking? So we're sort of trying to steer towards all that so that it's all there on the app for them, basically. So
perfect. I was going to say, the only piece of advice we would give is sometimes we don't look at, accessibility in its full on apps. So if you're doing any testing, it'd be really good to do an accessibility test, which I'm sure you've done, but sometimes it's forgotten about.
Yeah. No, well, we have done the accessibility, where it can read, auto read, and what for blind and visually impaired and blind, and that. So it's steered towards that as well. So.
Perfect. I know, Linda, we did an awful lot of work on that, when you're putting something out, and it's really great to connect in with those groups as well, just to see what works and what doesn't work in terms of those accessibility tools as well. For anyone who's starting their journey, it's a good thing to look at from the very beginning.
I have a question, Rebecca, and I know we've worked together on a number of projects with varying degrees of success. What happens when you have a bit of a conflict? So you have a service provider perspective, and you have a user perspective, and you have a clash. What's your professional advice on how you navigate those stormy waters?
Yeah, it's not uncommon. It's really not. And Hannah mentioned that when she mentioned the difference between policy and what happens sometimes in practice. So what we try to do is, again, try to map out the assumptions. So sometimes the business area will have a number of assumptions about what's happening within their service. And what we will try to do is test those as much as we can, because there's no way you can change a mindset unless you show evidence that what the provider is seeing is not exactly what's happening, or what they think the service needs is not exactly what is needed. So the evidence base is really, really important to that. I think getting out and speaking to the users, and actually what's been really lovely as well is we've started to get back to observational work. So sometimes even what the users are saying is not exactly what they are doing in practice, because they will, if you give them a bad system or a bad service, they will hack it until it works for them. Like, they will start to add different things, and they'll start to use it the way they need it. And sometimes then when you ask somebody, how does it work? They go, yeah, grand, because they've actually been able to make their way through it and created their own process from it. So sometimes I think given that evidence, whether it is through focus groups or one-to-ones or observational research, and then bringing the wider team back in to help you analyze that too. So it's not a case of sort of going back and saying you're wrong and this is right. It's about actually reviewing that data together so that you make a joint decision on the direction going forward. And it's not us telling them from what we've seen, but it's actually we've shared the evidence with them. That's the only way that I can see it working, if you make it very, very collaborative. But we have been in the situation where we've shared the evidence and the system won't change, or the service won't change what they're doing as well. And sometimes I wonder what the point is that you walk away. Like, Linda, you know me, I will fight until there's no more fight. But sometimes it's really, really difficult to put the point across. And sometimes budgets are an issue. Sometimes resourcing is an issue. Sometimes the money's already been spent on the technology. So it's really, really hard to change it. But I think gathering the evidence is definitely one, but also bringing your stakeholders back in to be able to go through it together is another way of just keeping everyone informed and everyone on board. And it's a joint decision then going forward.
Yeah. Thank you. Any other questions or comments from anybody?
We're Damien here
Hiya.
from the HSCNI team. Rebecca, is there any one thing we could do to help ourselves? Is there any resource that you could point us to that people, if they spend half an hour, 45 minutes on, get a taste of what they're letting themselves in for?
Yeah, so I think that book that Claire put in, that Hannah mentioned, so The Good Services by Lou Down, is absolutely, it's brilliant. It's a small book, it's not too much, it's digestible, and Lou has embedded this. She was the one that came into GDS when really they were starting on their design journey, coming up with the principles, making sure that everyone was trained in inclusion and accessibility was one of the key things as well. And actually what they started to do was create a community of practice within the organization just on service design. So that is a really, really great book to read. There's also a lovely one, Design Thinking and Health as well. But there are so many podcasts out there. If you are interested in design, IDOU is a really good one, all different types of design tips and tricks and new resources and things like that. And Maíra, you just did the RCA service design course, so I know you have a couple of really, really good resources as well for it.
Yep, I can put some, maybe a resource page together, a few articles, some things like that. That is easy to.
You can send it over. Yeah, but Good
Cheers,
Services
thanks.
is really good. Yeah.
Okay, thank
That
you. everybody.
RCA course, sorry, Claire, apologies for putting in there. That RCA course, Maíra, what was involved there? How long was it? What was the cost?
It was, this is being recorded, so it's not going to go on YouTube. But it was, I think, £1,500, something like that, maybe 1,200, 1,500. It was 4 mornings, and it's the basics of service design going from beginning to end. But it really gives you like an overview of that entire process of discovery, developing, testing, iterating, and delivering a prototype. The other option for a course is the course that is being hosted by the person who wrote this book, Good Services, and Hannah's doing that one at the minute. Do you want to say some words, Hannah, about that other course?
Yeah, I mean, it's really good. I've only kind of just done the first day of it, but it goes into more deep depth into what that book covers. you know, like about challenging briefs as well. A brief should not be in stone at the start, and we want to kind of move from these closed briefs to more open briefs and really try and learn through the process. But yeah, there's so much to learn still, and just by practice, I think, you know, you pick up on what way best things should be done.
Yeah, I think that was the reason I was jumping in on the you know, professional continuous development point. This isn't something that is going to come from some central initiative or mandate. You know, we're going to embrace this methodology. That's not how this stuff really scales and spreads. It's organically through people seeing and experiencing how useful it can be, and then seeking to adopt and embrace some of those methods themselves. And a lot of this is just bloody common sense.
It is, yeah.
Involving people in a conversation about how they want to interact with services is not something that's new to health and social care, but it's not something that we always do as much as we should, I think is the point that I would generally arrive at here. And if we can help people to build the skill sets and the tools that allow them to do that more readily in their work, and give them the space to do it well as we commission technology investments and the projects to then drive implementation and adoption, then I think we'll be going in the right direction. And that's the sort of thing that I would be really keen to see us do, is to make some of that educational stuff, the professional development stuff, available to anybody who's interested in availing of it. So maybe Claire, we could chat about that and just follow up with these guys on what some of those opportunities look like.
Yeah, the Health and Social Care Leadership Centre is trying to do that. I know they're looking at sort of a one-day course, a half-day webinar, things like that. So that's probably worth following up on as well, how they're getting on with that. But yeah, that could be an option, an easier option internally for people if they wanted to know more.
Yeah,
that'd be really great. We will do that. And it was great to see so many people, even though it was half term. It was great to see so many people on. And I think my one thing, and Dan will know this has always been what I've been, I think we have to, I think what Hannah said there about opening the brief. I think often we have worked in health and social care for so long, we come to the topic or the conversation already with a very clear idea of what we're going to do. And we need to open our heads. How often have we heard something, oh, we're going to develop an app? And we go, oh no, here we go. Because you need to listen. You need to listen to the story. You need to listen. You need to understand what the people want and how people are using and what their journey is before you can come to the conclusion of what it is you might actually have to develop or put into place. And sometimes you walk away because you don't actually have to change anything. So thank you everybody for coming this afternoon, and we will follow up any resources that we pull together between ourselves and Big Motive, and we'll get those out to everybody who's attended today. And just on behalf of HSCNI, Rebecca, Hannah, Mari, thank you very, very much for your time, and we will see you all very soon. Thank you everybody. Have a good afternoon.
Good to see everyone.
Cheers everyone. Thanks guys. Bye bye.